Attendees are in listen-only mode.
Hello, good morning and good afternoon, everyone. Thank you for joining us today in this webinar. My name is Sono Aibe, and I am the Senior Advisor for Strategic Initiatives at Pathfinder International, and I am your facilitator for today's webinar, which is focused on advocacy for family planning. I'm very pleased to welcome all of you today and look forward to hearing from you. You may enter your questions in the question box on the right throughout the webinar, and we will address questions at the very end. Please note that if you are directing your question at a particular speaker, we will try to address those questions appropriately, and we will try to answer as many of your questions as possible. We're recording today's session, and we will be sending out a link to the recording very soon after this session. Please take a moment to download the handouts that have more information on Advanced Family Planning's SMART approach. You will see the handouts in the box underneath on the right. So let me turn to introducing today's panelists. So today we have Beth Frederick. Beth will begin by providing an overview of Advanced Family Planning's advocacy work. Beth is Executive Director of the Advanced Family Planning Initiative of the Bill and Melinda Gates Institute for Population and Reproductive Health with the Johns Hopkins Bloomberg School of Public Health. She is also Senior Associate within the Department of Population, Family and Reproductive Health. Next, we will have Habib Salami. Dr. Habib Salami is the Program Manager for Pathfinder International in Nigeria. Habib is a medical doctor with a specialization in obstetrics and gynecology. He has more than 10 years of experience in public health project management, as well as monitoring and evaluation. He joined Pathfinder in 2012 and currently oversees Pathfinder Nigeria's maternal health and family planning programs. And from Tanzania, we have James Mlali, who is the Advocacy Program Manager at Health Promotion Tanzania. James has extensive experience in family planning advocacy, using evidence from research for influencing decision makers both at national and subnational levels. For over 5 years, he has been implementing the Advanced Family Planning Project and successfully influenced the central and local government authorities to consistently improve policies and increase investments. So why is advocacy so critical to advancing? Why should we be increasing our advocacy efforts now more than ever? First, the target of universal access to sexual and reproductive health was not met under the Millennium Development Goals. And we're now all pushing hard towards the goals set under Family Planning 2020 and also the Sustainable Development Goals towards 2030. Despite the great evidence of need and calls to action, donor support for family planning has stagnated. Donors and governments are under pressure to meet the much more expansive agenda of the Sustainable Development Goals, and new funding mechanisms are created, making it difficult to find dedicated family planning funding streams. At the country level, decentralization and devolution of power means that decisions are increasingly made at the subnational level. So it is crucial to nurture family planning champions at every level down to the village to exert political leadership and increase local ownership. We are advocating to increase local government allocations for family planning in order to sustain the gains of donor-funded programs when funding for those programs come to an end. Before we introduce our two African speakers, Beth will expand on why advocacy is important and introduce the Advanced Family Planning Advocacy Model and the AFP SMART tool. Beth.
Thank you, Sono, and good morning or good afternoon, everyone. It's a pleasure for us to be part of this webinar, and thanks to Pathfinder International for organizing our webinar today. I want to start by talking a little bit about advanced family planning and why this initiative started in 2009. We began with the simple aim of testing whether the use of a very focused advocacy approach can deliver results. After 7 years, we can confidently say that it can, and we are very happy to share with you a little bit of how we use the advocacy approach that AFP Advanced Family Planning has developed. Next slide. One of the reasons that we think advocacy is so important is that decisions around family planning and reproductive health are made at a variety of levels. And it's important that we are within that complicated environment that we focus our advocacy on very specific advocacy targets. So decisions, as you see in the slide, are made at the global, regional, national, county, state, provincial, district, village, commune level, making it very complicated to actually fulfill global goals around, for example, the FP 2020 partnership. We, in the course of our work on advanced family planning, we have often seen that advocates have a very long time horizon, and people don't always think that they're making progress. But it is possible to make progress over time. And by concentrating on something that we call the quick win, which is a discrete critical policy or funding decision that must occur in the near term to achieve a broader goal, we're able to make incremental progress toward bigger goals and bigger aims in a way that really leads to overall success. Next. AFP's strategy is simple, and since 2012, we have been able to, we've been funded to work toward the goals of FP 2020 initiative to add 120 million more women who would use modern contraception. We have three main objectives. The first is to mobilize and sustain effective family planning advocacy at country level. The second is to amplify voices from the South and make sure that Southern champions have their say in the global and regional arena. And finally, we are dedicated to diffusing advocacy best practices, which is why we're on this webinar today. Currently, we're active in 10 countries, and you can see those on the right-hand side of the slide. And you'll hear from two of them, Nigeria and Tanzania, today. Next. So here are the basics. We're supported by the Bill and Melinda Gates Foundation, the David and Lucille Packard Foundation, and the William and Flora Hewlett Foundation. We've been in existence for 7 years. We are organized around 7 principles that are not very unique, but they are important when they're combined. We're locally driven, which means that our local advocacy partners actually set the agenda and implement every strategy. We're focused exclusively on family planning and exclusively on family planning policy, even though we are confident that the advanced family planning approach could be used for other issues. We're evidence-based, basing our advocacy recommendations and policy recommendations on the best research. We're collaborative and try and build in and bring in coalitions throughout our work. We try to be influential, and this is probably the most important part, identifying the people in power who can move the agenda forward. We're accountable in terms of trying to document how we've done our work and showing how advocacy connects with bigger impact. And we try and build in sustainability. You'll see as we go through the advanced family planning approach, and you hear from Habib and James, that this approach, while time intensive, is actually quite cost effective and easy to implement. AFP's advocacy approach is cyclical in the sense that we first go through a process of identifying opportunities within the policy landscape and developing an assessment of where there might be opportunities for advocacy over time. Then we bring together very specific and customized coalitions around SMART objectives. And for those of you who don't know what SMART is, it's specific, measurable, achievable, relevant, and time-bound. This is probably the most important part of our approach, but it is a very common acronym that's used worldwide and has actually been around since 1981 when a management consultant actually coined it for his team in order for them to be more effective in project management. Each SMART objective leads, we hope, to a quick win, which is, as I said, a small incremental change and a discrete policy change that will lead to bigger policy and health outcomes. Once we've achieved that quick win, we then try and see how to validate whether or not it will have an impact over time. And then we go back to looking at the policy arena to see what new objective might be relevant to that larger aim. So I'm not going to go into these steps in detail. You can find these on our website. But there are 9 steps to the AFP SMART approach in 3 phases. The first phase is to build consensus so that your coalition is all of one mind on what is important to take forward. The second is to focus efforts, and that involves a lot of choices between different decision makers, different policy opportunities, and what you're really going to ask for at the end of the day. Phase 3 is achieving change, and everyone who's ever done any kind of project knows that this is the hardest work, but it's the most important in terms of developing a work plan and figuring out if you're going in the right direction. I don't expect you to be able to read this slide, but you should be able to see the impact over time of advanced family planning's advocacy work. In the beginning, there's a big mix of global, regional, national, subnational in the left-hand corner. And by the time you get over to the right side, you'll see that our work at subnational levels, because of devolution of governance, has increased exponentially. And that's because every new subnational unit that we work in requires follow-up after our quick wins. And so we continue to add quick wins and follow up on them at the subnational level. So I'm going to take just a few minutes to talk about the lessons we've learned over 7 years. The first, as I said before, is to make smart choices. We can't do everything at once, and it's really important for us to focus in on the things that we really can achieve in the short term. Little by little, those build into much greater support for family planning and much more progress for women and couples in terms of their access to contraceptive information, services, and supplies. We want to be intentional about impact. Often advocates are looking at big overall goals like ending hunger or gender equality or reproductive health for all. When you do that, it's very hard for people to see that your little advocacy effort leads to something much bigger and much more important. So we try and be intentional about that bigger aim from the beginning for our smaller, more discrete advocacy efforts. Number 3, we want to swim with the current. Our colleague Halima Sharif in Tanzania coined this phrase early on in advanced family planning, and it's true today as it was then. Swimming with the current means that you try and work hand in hand with policymakers and develop your networks with donors and other stakeholders so that you know what they want to do and where they have roadblocks. In many ways, the advanced family planning approach and its success over time has been due to that kind of information and the ability to help policymakers actually fulfill their commitment to health, to development, to women's rights, to any of the work that we're all trying to further. Number 4, we want to keep it simple. So we try and make it as easy as possible for people with other jobs, and most of the advocates in the countries where we work are full-time employed in implementing programs. We want to make it possible for them to implement an advocacy strategy on the sidelines. So we try and make the work, to share the work, and also to make each task as simple as possible for someone to carry out. So oftentimes what that means is organizing a meeting, or making a phone call, or bringing together evidence in a very simple format. So it's not onerous on anyone to take part in an advocacy effort. Number 5, we build in adaptivity. Anyone who's been an advocate over time knows that there can be things that come out of the blue that make it important for you to reassess your strategy and take a new issue forward. That can be everything from a setback, where you have a new political leader who doesn't like your agenda, to an easy success, where all of a sudden it's time for you to just move fast so you can build on that achievement. Number 6, we want to leverage resources. So we take everything from the community that we're working in, from operations research and the findings from that, to the very experienced advocacy acumen of our partners in other organizations like Pathfinder International. And finally, we want to tell the story so that other people understand that advocacy is important, it can be effective, and it's not so hard to do if you really plan effectively. For more information, we really encourage you to visit our website, www.advancedfamilyplanning.org, and you can feel free to email me as well if you have any follow-up questions that aren't answered in the course of this webinar.
So thank you so much, Beth, and let's go to Habib for a presentation about Nigeria. Habib?
Thank you, Sonora. Thank you, Beth. Hello, everyone. My name is Habib Salami, and I will be presenting about how we use the SMART approach to achieve a quick win in Nigeria. Next slide. Pathfinder's goal is to work with the government of Nigeria to help fulfill its commitments to the FP 2020 goal to increase the modern contraceptive prevalence rates to 36% by 2018. We work in the context of the AFP goal to improve access to and use of quality voluntary family planning services, information and supplies by increasing funds, decreasing policy barriers, and increasing the importance of family planning among policymakers at global, regional, national, and subnational levels. We work at both the national and subnational level in Nigeria. We started this work in 2014. At the subnational level, we're working in 13 states. So today I will focus on our work in KWARA State. Next slide. KWARA State is located in north central Nigeria and had a projected population of 3.14 million as at the end of 2015. This is based on the 3.2% growth rate from the base figure of 2.365 million in 2006 when the last national population census was carried out. KWARA State is in one of the areas in Nigeria that has worst health indices. Our original objective, working with the local advocacy group in KWARA State, was for the Commissioner of Health to release approved funds for family planning in KWARA by the end of the second quarter of 2016. However, due to delays in the approval process, this objective became unachievable. However, we saw an opportunity to advocate instead for an increase in the budget for family planning, and that is the advocacy action I will present today. As you can see, Many of the indicators in KWARA State lag behind the national average. However, it is interesting to note that the CPR is actually higher in KWARA. This is one of the reasons we choose to work there. KWARA was one of the states targeted by the Gates-funded Nigerian Urban Reproductive Health Initiative, NORI project. KWARA was one of the few states targeted by that project that showed an improvement in CPR. So we felt KWARA has a very high maternal mortality rate. This is in part due to high frequency of home births. So despite the progress on CPR, there is still a need for a significant investment in family planning in KWARA State. Next slide. As Beth mentioned in her presentation, AFP approach is in 3 phases. The first phase is to build consensus. And the first step here is to decide who to involve. The group in KWARA State was initially formed by the NORI project, and they are registered as the Advocacy Core Group of Nigeria. Pathfinder took over support to the group in 2014 at the end of the NORI project. As I mentioned in the last slide, we decided to sustain and improve on the achievements of the group during the NORI project years, hence the reason to work with the group. So the group's advocacy capacity was strengthened by Pathfinder using the AFP SMART approach. So the next step was to set a SMART objective, and this was done using the AFP SMART approach for an increased budget line for FP from 2.2 million in 2015 to 4.05 million in 2016. The next step was to identify the right decision maker. The Commissioner for Health was identified as the right decision maker for this act. The group had initially thought that the governor of the state was the advocacy target, but after a serious debate by the members of the group and additional information provided by stakeholders from the Budget and Planning Ministry with regards to the budget process in the state, it was finally agreed that the target should be the Commissioner for Health, although the buying of the chair of the House Committee on Health will also be required for the House of Assembly endorsement. Next slide. The next phase is to focus our efforts on achieving our set objectives, so we had to review the context. In reviewing the context, it was believed that achieving a CPR of 39.9% is very important to the state and the working group. In addition to reviewing the context, in February 2016, the Advocacy Core Group, which is the local advocacy group in KWARA State, with support from Pathfinder International, finalized the State Costed Implementation Plan, CIP, for family planning. The KWARA CIP was based on the National Family Planning Blueprint that articulates each state's contribution to the national target of achieving a contraceptive prevalence rate of 36% by 2018. The CIP proved to be a valuable tool for evidence-based advocacy. During the launch of the CIP, the Commissioner for Health made a commitment to response for family planning. Based on these statements, evidenced by the publication in the Herald newspaper, the group assessed that we should ask him for additional money for FP. So this, along with the fact that achieving the CPR of 39.9% by 2018 is very important to the state and the working group, provided the context within which the set objective can be pursued. Now the next step was to think about the decision maker. As I said earlier, the decision maker had already been identified and analyzed in the last objective implemented by the group, which was the launch of the CIP. Now, the third phase, which is achieving our change, focuses on developing a work plan based on the advocacy objective that have been set. And the AFP SMART was used to develop the work plan for the advocacy activities. Within the advocacy work plan that was developed, milestones were set to help assess implementation and determine when objective has been met. We now proceed to the last step, which was to implement and assess. The group met with allies and realized further evidence was required to achieve the objective that was set. The advocacy group worked with the reproductive health and family planning managers within the State Ministry of Health and Primary Healthcare Development Board to use the CIP to rework the initial budget submitted to the State Assembly for an upward review. The CIP provided the evidence to support the ask. Next slide. And so, a quick win was achieved in KWARA State. We were successful in achieving our objective of increasing the budget allocation for KWARA by about 90%. However, getting these funds released is not automatic. It is a different process entirely from budget allocation. So this takes us to the next step, which is to ensure that the allocated funds are released for AFP services in the state. The advocacy group, therefore, has recently revised the objective using the AFP SMART, targeting a different decision maker to ensure allocated funds are released for AFP services in the state. Within this process and the others that we have carried out, we've learned a couple of lessons. And the first one is to know your audience. We need to know your audience both in terms of partners and those you're advocating to, and also being very familiar with the AFP SMART as it is. A flexible tool, just like Beth had mentioned, and allows you to move around from step to step, or sometimes skip steps, depending on your familiarity with the SMART tool. You need to do your research, find the evidence, and lastly, use the evidence for advocacy in order to achieve the set objective. Thank you.
Thank you very much, Habib, for that exciting story from Nigeria. We have been having some technical difficulties this morning with Tanzania and the connection there. So I think we're unfortunately unable to get James on the line, but let's see if he's able to speak through the phone right now. James, can you hear us?
I can hear you now through the phone. It's clear. Hello?
If you could, yes, if you can speak up a little bit.
Okay, I can hear you now. Can you hear me?
Yes, we can hear you.
Okay, thank you very much.
Go ahead, James.
Thank you very much. Good evening. Good morning for those who are in the U.S. I'm James Lowry from Health Promotion Tanzania, a partner implementing advanced family planning, which is a project in Tanzania made up of local partners whose logos are shown in the screen, as you can see. Tanzania Communication and Development Center, United Nations Association of Tanzania, Health Promotion Tanzania, and the rest are the logos for AFP projects and Johns Hopkins. We have been implementing this project since 2009, and in the last 7 years, advocacy has improved family planning policy, increased budget allocation, and raised visibility for family planning at national, regional, and district levels. Like Nigeria, budget advocacy helps lead to government investment. The government of Tanzania has consistently passed the family planning budget in full, even during the recent election year 2015. In June 2016, the National Family Planning budget increased by $1.2 million from the previous year for a total of 5 billion Tanzanian shillings, which is equivalent to 2.3 million US dollars. Our local government also continued to increase allocations for family planning. In just the last year, 30 local government authorities, which we call district councils and municipal councils, allocated a total of US $98,000 in their own funds for family planning in full in the Western and Western Europe. These are areas where the contraceptive prevalence rate was the lowest in the country. Advocacy has helped us to cooperate successfully with corporations. As of May this year, the biggest private health insurance company in Tanzania, which is called AAR, was the first private insurer to integrate family planning into its coverage and outreach services. Today, however, we want to focus on advocacy wins that put youth at the forefront. In October 2014, several higher learning institutions, we can call them HLIs in short, in Tanzania, banded together to improve their students' access to sexual and reproductive health information and services. The effort started modestly with only 13 higher learning institutions in the largest rural regions of Mwanza and Shinyanga. However, 1 year later, the initiative was poised to benefit over 18,000 students in the two regions and contributed to a nationwide policy change to mandate sexual and reproductive health services provision in all 52 learning skills in Tanzania. Next. Advocacy began, as I mentioned, in early 2014 when United Nations Association of Tanzania conducted a baseline survey of 15 institutions in the regions where AFP Tanzania was active, that is Mwanza and Shinyanga. The survey identified types of available sexual and reproductive health services, if any, and investigated the reproductive health related issues that affected students there. The survey revealed common stories. Number one, unintended pregnancies among students, which were leading to abortion and other risks such as HIV/AIDS and sexually transmitted infections. As a result, some of those students were postponing their studies to take care of their pregnancies and babies. Although abortion is legal in Tanzania, many women seek it illicitly, opting to unsafe abortion. So some students were opting to abort and suffer consequences. Some were dying and others were suffering long-term consequences because of those unsafe illegal abortion. While meeting with the dean of this institution, one of them stated that we are grappling with challenges of sexual activity in our institution. And in some cases, we are losing our young girls to abortion. We must do something about this. This is to say, American institution students were lacking sexual and reproductive health information and services around their campuses. Next. Using the AFP SMART approach, we created our objective, which was to make sexual reproductive health and rights and family planning services accessible to students. 13 of the higher learning institutions in Mwanza and Shinyanga, which included vocational training centers, medical colleges, business schools, and faith-based universities, committed to actively address the information and service gate, which was identified. Achieving the advocacy objective would impact more than 18,000 students enrolled across the 13 schools around those two regions. UNA shared the key findings in one meeting with student deans and other decision makers from those institutions, including leaders of student government. UNA and participation engagement among higher learning institutions, providing guidance when the higher learning institutions lack the infrastructure to address student needs, encouraging follow-through, and linking schools with family planning stakeholders. The deans played an important role in this process, providing insight and commitment to action. The institutions in each region took different approaches. Those in Mwanza region took an approach whereby family planning providers like GKT and General Maristo Tanzania and Population Services International established outreach services to these institutions. Also, the district medical officers joined and also committed to provide services in this institution. One regional hospital in Mwanza, called the Kakure Regional Hospital, also joined and committed to be reaching out to the higher learning institutions periodically. Officials from 8 higher learning institutions in Mwanza worked on ways to provide information and supplies to their students. The approach varied by school. For example, St. Augustine University, which is a Catholic institution and the largest in Mwanza with more than 12,000 students, did not permit for the state to supply on campus, but provided referrals to places at sea. They entered into a partnership with the service provider Umati for Umati to render information and services of campus. The majority of higher learning institutions agreed to host information counseling services sessions, which included information on where to obtain perspectives. Maristo Tanzania used a different model. They had a campaign whereby they were using rickshaws which are called bajajis, which are three-wheeled outdoor models, to do outreach services in those campuses. And between March and June 2015, they conducted 11 of those Bajaj campaigns for the higher learning institutions. And they provided a full range of services through this approach, including immediate contraceptives, pills, male and female condoms, and injectables. Their data showed that the number of young people under the age of 25 who accessed family planning during this period increased by 7% compared to the prior period of 3 months. In Shinyanga, the strategy was different, and it involved mobilizing the resources of the higher learning coalition. In this area, representatives from the region 5 higher learning institutions developed a memorandum of understanding in October 2016 to outline the nature of their cooperation and the members' respective roles and responsibilities. This memorandum of understanding highlighted the interest of higher learning institutions in working with family planning stakeholders, providing information and services to students. One of these higher learning institutions, called Orlando College of Health Services, trains nurses and nurse midwives. This one volunteered to interpret provision of sexual and reproductive health education to other higher learning students into their curriculum, as well as offer referral services. In October 2015, the college trained the students So in October 2015, the college trained 30 student service officers who were primary deans of students and 25 government representatives across the 5 Shinyanga higher learning institutions to strengthen mentoring and counseling. Other institutions also integrated sexual and reproductive health into their respective curricula. All 5 of these in Shinyanga mobilized the students to establish a reproductive health class. Students in 3 of those schools already had class led by sexual and reproductive health orientation activities. Now, let me also mention that although the approach differs in Mwanza and Shinyanga, the overall outcome is greater access to information and services. Almost 3 years since AFP's rapid assessment in Mwanza and Shinyanga, things have progressed further. Students, government, and class have a growing interest in sexual and reproductive health and rights in information and services. Service providers have continued their outreach. Even Catholic colleges like Catholic universities like St. Augustine have allowed service providers like UMATI to come to the campus and conduct an awareness program. The university also has signed an agreement to collaborate on sexual reproductive health and rights issues, focusing on knowledge development with limited service provision. Given the success, we decided to think bigger. So in September 2015, AFP Tanzania partners convened a meeting with the Tanzania Commission for Universities, which oversees the establishment and monitoring of all higher learning institutions. Many stakeholders attended, including leaders from higher learning institutions in several regions, service providers who supported the higher learning institutions, and the other civil society. The meeting aimed to examine the impact of intervention over the last year and what the Tanzania Commission for Universities could do to lead such efforts. In the end, three federal committees, primarily at the Tanzania Commission for Universities, would issue guidance and directives to ensure sexual and reproductive health information is available in all of 62 areas across the country through training manuals, health checks, and mandate administration, make family planning and other sexual and reproductive health services available to the students. Currently, draft guidelines are in place to be adopted by all the universities accredited by the Tanzania Commission for Universities in both mainland Tanzania and Zambia. Next. From this initiative, we expect a decrease in unplanned pregnancy cases, unsafe abortion, and other complications such as maternal death among students. Next. The key takeaway that falls in line with the evidence-based advocacy approach is that sharing evidence is a way for dialogue and action. The deadline survey findings gathered and shared by United Nations of Tanzania is connected with higher learning institution officials. The evidence confirmed their fears that students were ignorant and disempowered about sexual and reproductive health issues and services, while unwanted pregnancies, early childbearing, and abortion characterize the lives of young women in these institutions. The findings paired with evidence on successful intervention spurred them to address the issues through constructive dialogue. This full case study is available on the AFP website, and we will share the link with you at the end. Thank you very much.
Thank you so much, James, and thank you everybody for hanging in there with some of the technical difficulties we've had this morning connecting James. So now we have questions and answers session. We have a good amount of time, so please don't be shy and ask your question in the chat box. First, I think there was a question from one of the participants around what were the indicators for measuring achievement in all of this work, and how do you look at the achievements vis-a-vis the costs that are spent on this project. So I will invite the Advanced Family Planning team to come in and comment on that.
Hi, Sono. It's Beth. I'll let Habib build on what I have to say first, because this is an ongoing issue for advocates in general, and it's something that we in Advanced Family Planning have taken very seriously and have tried to work on over the course of the 7 years of our work. As you know, it's really hard to connect an advocacy effort to a policy change, because really the decision maker is the one who takes credit. And then once the policy is changed, it's even hard to find out whether it's been implemented and implemented properly. And then once the implementation is through and maybe services improve, it's very difficult to see if women are using the contraceptive methods they want, or if they are using having better access to quality services. That said, you can, once you have an advocacy win, as James described in the HLI work, you can from the outset figure out how many potential people will benefit from your policy win. So he mentioned the number of students in Shinyanga that might be affected if higher learning institutions took action. And that's the baseline for figuring out whether or not your advocacy had an impact over time. So what you would do is, once you've had that first quick win and you know what the baseline is, you'd start looking for other data sources within the region where you're working, or for the country as a whole, if you can't find subnational data, and figure out from there over time whether things are changing in the direction you expected. In short, I've just described Advanced Family Planning's theory of change that connects the work that we do with decision makers down to the impact for people's lives. And I'm sure that's it. I'm glossing over a lot of the fine points, but I hope you get the general impression of how we think about indicators. And Habib, do you have anything to add?
Yeah, thank you, Beth. I must say that advocacy's work is one of the most difficult things to track in terms of what you are doing and how much you are spending. But for us, what we have done in terms of the indicator to show that we have achieved is to set the objectives and take the quick win that comes from that objective as an indication of achieving the objective. So that's what we use to monitor ourselves, and that's where the AFP approach comes in a very smart way and different from the other approaches available. So we set a very short term for ourselves in terms of carrying out the advocacy efforts and trying to achieve those objectives. So if we set out with a couple of objectives and we're able to achieve those objectives within the time set, then the quick win that is achieved is what we use to indicate that we have made progress. But as Beth said earlier in our presentation, the quick wins are pieces of the general or overall broad goal or objective that we want to achieve in the longer term. And so it's difficult to, within a short time, say this is the impact of the the advocacy activities that you have carried out, or solely ascribe the attribute your achievements to the advocacy effort. It comes with a spiral effect. So for example, if we're advocating for funding for family planning, and our goal is to get CPR to 36% by 2018, we have a lot of objectives that we can set between now and 2018 and work towards achieving that. So if one of the objectives is to set a budget line, we work towards we get a budget line, we move to the next step where we set objectives to get that money released, and once it comes out, we move to the next step to get that money to provide services, train providers, for example, get commodities to the last mile where clients will have access to it, and use the money to also do mobilization for people to come out and access services. By the time we measure this over time and come back to check what the contraceptive prevalence rate is at the end of 2018, now whatever figure we get, whether we're able to get to the 36% or not, will tell us how far we have come. So that's how it is an incremental thing that we do over time. And sometimes it's very difficult to put a cost to what it would be for an individual beneficiary at the end of the day, or a group, because the efforts that will go in advocating for a particular objective might be different from another objective within the same context, or entirely in a different context might be different. So that's a pretty difficult thing to do. But what we try to do is that we are very conscious of funding and activities and ensuring that they are basically funding to for advocacy activities and not anything else. Thank you.
Great. Thank you so much, Habib and Beth, for explaining some of that, and definitely a topic for ongoing discussion in the advocacy world. So we have another question. This one is directed more towards Habib in Nigeria. So definitely you already spoke about the challenge, the next step, which is beyond the inclusion of family planning in the budget line. We need to get to allocation and then to ensuring the proper release of those funds, and then ultimately the judicious use of those funds for the intended purposes of supporting family planning services, information, and commodities. So if you have some thoughts about your current work in terms of making sure those steps are followed.
Yeah, thank you very much, Sono, and for the person that put up the question. Yeah, so as I said in my presentation, the group first is for us to ensure those steps are, followed up through. We work with the local group who are there on ground, and it's easy for them to follow what is happening. So as soon as the set objective for an increase in funding was achieved, we work with them to quickly move to the next step, and that's coming up with an objective to get the funds released. And interestingly, from the work they did, they realized that for the funds to come out, they need to target a different decision maker. And that was the dynamics within using the AFP approach. If you don't understand your audience and understand the context you are working in, you might just be advocating and targeting a different, wrong person. So that's been done, and now they've started their advocacy activities to ensure that that money comes out. At the same time, they're also working closely with the AFP manager in the state to ensure that the work plan that was developed for the funds to be allocated is still used to when the money comes out. So the activities that were in that work plan needs to be implemented, and so the working group are following up closely with them to ensure that is done. We are also remotely following up with the group and the FP RH manager to ensure that this thing happens. And once the money comes out too, we are also in a position to support the State Ministry of Health, the RHF manager, to provide some technical support in terms of the trainings and logistics and other things that they will need to ensure that those activities within the work plan are carried out. So it's an ongoing process. We are not going to, it's not what you, after you have achieved an objective, then you sit down, go and be clapping for yourself that you have win, have a quick win and then nothing else to do. We have to keep following this, and we'll come back next year if we're able to completely carry out the activities within the work plan, ask for more money, and continue our advocacy to ensure that the money comes out, and continue to work closely with the FP RH managers to ensure that those activities are carried out and people have access to family planning services, and they have provided quality family planning services. Hello?
Seems like Sono may have left the call. This is Beth. It looks like we have a question regarding how we would track the long-term impact on contraceptive prevalence rates, maternal mortality, etc., and the impacts of increased family planning use. And this is an excellent question, and one that I think often in advocacy we...
Yeah, so that's interesting.
Go ahead, Habib. You can answer.
Apart from in-country... Hello?
You can talk. Go ahead. Habib?
Can I go ahead?
Do you want to answer that question, Habib?
Yeah, okay. Can I go ahead?
Yes, please.
Yes. Okay. So there are a number of ways that that can be done. There's the routine, the demographic analysis survey that is carried out every 5 years in Nigeria and some other countries. This provides an avenue to assess what the current CPR is for that particular period that the health survey is carried out. Another one is due in Nigeria soon. But apart from that, there's also the PMA 2020, Performance Monitoring of Accountability 2020 of the FP 2020 movement that does frequent surveys that also includes measurement of CPR. That is currently going on in Nigeria. That is carried out every 6 months. So that's easier and more frequent way of measuring how we're making progress in terms of CPR or not. I hope that answers the question.
Yes, thank you, Habib. I am back, and does anybody else have anything to add there? Okay. So I was going to ask a question to the team regarding the SMART approach, because I think it's a very interesting stepwise approach to advocacy strategies and getting to the benchmarks. So I'm wondering if the AFP team could give us some more thoughts about how difficult was it actually to use the SMART tool, because always, you know, you're working in a coalition, you have many different groups with different interests, and using the tool may sometimes not be as simple as it may sound from the slides that you presented. So Beth and Habib and also James, if you could hear us, please go ahead.
James, do you want to start since you're on right now?
Hi, James.
Okay, so it doesn't sound like he's back. I can tell you from my
so I could. Okay.
Let me start, Habib, and then I'll hand it over to you. I think that probably the hardest part about using the advocacy, the AFP SMART approach, is taking the time to strategize together and really gathering people around a table to think deeply about the environment in which contraceptive services and information are being supplied, the policy barriers that might be addressed, all the different parts of ensuring people's access to reproductive health services that come into play when you're doing a landscape assessment initially. And then making the hard choices to figure out what you might be able to achieve in a reasonable amount of time. And it sounds simple, except that it really does, as you go through the process, you realize that there is rarely an opportunity when people in a coalition can share their own intelligence about a situation and think strategically together. Once that's happened, as Habib said rightly in his presentation, once somebody knows the approach, you can be a lot quicker in doing it. But that first time, it takes a lot of effort and time to be thoughtful about advocacy. And I think that's the hardest part. Actually implementing the strategy after that is not so hard, and it doesn't take much. I don't want to make it sound like it's not important or you don't have to be thoughtful afterwards, but that first planning section is really the hardest one. Habib, what do you think?
Thank you, Beth. You're absolutely right. I think, like we have in the AFP approach, the 9 steps, I think the first step is critical to agree on what we want to do and who to involve. Once we get that step right, and I can assure you it really doesn't come easy. That's where all kind of interest comes in, and everybody wants to push their agenda. But one thing we've been able to do in Nigeria is that we get the group to work closely with the FP managers in the state. And so what we do is to prioritize the state's agenda so that everybody works towards that. So the state FP manager give us a situation analysis of FP in the state. We also have information from our own hand that supports or sometimes refutes such information that the FP managers give, so that we are all in one page in terms of what the challenges are for FP in that state. And once we have identified those challenges, what we do is to prioritize those challenges and asking a very simple question. So if the governor of your state says, FP manager, I have money for you, a small amount of money, what do you want to do? That's the question we pose to the FP manager in the state. And from there, we're able to prioritize those issues. Those are what we turn into advocacy objectives, and it's very easy for us to follow through as a group to agree on what to do. So once we're able to move from the first step of agreeing on who to involve and what to work on in terms of advocacy, I mean, just like Beth said, every other step becomes quite easy, I must say, and becomes easier the more you're familiar with the approach. Sometimes you do have to follow all the steps in the phases of the AFP approach. The more you become familiar, sometimes you have the opportunity of skipping steps. So, well, as I said, and just to corroborate Beth, and that the first 2 steps are very, very critical. And once you are able to overcome those 2, things becomes easier. The second step, setting the SMART objective, is actually the rate limiting steps in terms of all the other steps. Because if you don't set the right objective, you probably will be chasing the wrong decision maker and start moving through the steps, I mean, from there getting the wrong things. So we need to get those, decide who to involve, reach a consensus, set a SMART objective, and you are good to go in the other steps that you have.
Thanks, Habib. That's really helpful. I'm going to see if we can get James to comment on the same question about the SMART tool and some of the challenges that he might have faced.
Hello.
Go ahead, James.
Hello? Okay, thank you. think the most important steps and necessary things that need to be done is to make sure you relate the issue to the decision makers in a way that they can see it is an issue that really affects them or affects their community, and help them to own it so that it is something that really is big to them. And then plan properly on how to go about the processes with your evidence packaged very well, and targeting the right decision makers properly with the right messages, but also making sure you speak the language that they can understand. Now, speaking on the case that I have presented here, when we approached the leaders of the higher level institutions in Mwanza and Shinyanga at the initial stage, somehow we touched on an issue that they were really struggling with. In the first meeting, I remember, almost all of them mentioned that abortion and death resulting from abortion was a big problem, including stigma among those students who were deciding if they are pregnant. There are other problems like conflict among families, because in some cultures here, when a girl gets pregnant before marriage, it is a shame to the family. So it was causing a lot of problems. So that became one of their issues, the issues that were clearly touching them, and they were looking for solutions. And the challenge we faced initially was with the Catholic-owned institutions because of their policy on family planning, but gradually they came to understand that it was an issue that was really affecting them and their community, including students and the staff as guardians of the children. So that's why, despite the fact that they did not allow contraceptives in their campuses initially, but gradually they have been taking steps towards changing that stand and providing room for information to students and counseling. In the agreement for memorandum of understanding that I have mentioned, some of the universities that are owned by the Catholic Church have gone a little further to the point of including SRH into their curriculum, which is a step towards probably full inclusion of the issue. We have also noticed that pro-life groups of the Catholic Church operating in those campuses have also embraced the agenda and have made it part of their activities whenever they meet with students, which they do once a year. And generally, I would say, coming to the dialogue that we had with the Tanzania Commission for Universities, it became clear during our first meeting with them that it was also an issue that really was in their heart and they were looking for solutions. And at our coming and the way we communicated, they saw a solution coming out of an issue they wanted to find a solution for. However, the biggest challenge with the Tanzania Commission for Universities has been the change of leadership after the new government. As I'm talking now, the leadership of Tanzania Commission for Universities has been changed at least twice. And we have had to struggle to familiarize with the new leaders, orient them on what has been going on and what we really want to do, and make them embrace the agenda and move forward with it. Otherwise, if the leadership had not changed, we would be talking about guidelines that have already been signed and being implemented.
Great, thank you so much, James. It was great that despite so many of the challenges you mentioned, you were able to really think big and think at scale for this work. So I had another question around documenting successes, and as James explained, advocacy is really not often a straight line. There are always changes happening. Policymakers come and go, and sometimes we have to restart activities. Advanced Family Planning Project has done a great job documenting some of these successes and also creating a graph like the one that you saw earlier in the presentation. So my question to the Advanced Family Planning team is what are some of the ways currently that you are documenting these advocacy successes, both by yourselves but also with all of your partners, and what lessons have you learned there?
Thanks, Sono. I'll start with that, and then James or Habib can add on. We recognized from the beginning of advanced family planning that there was a need to better document and at least move toward evaluation of advocacy efforts. And in the course of the first 3 years, we developed something called the results cascade. And we could do an entire webinar on that at some point, and we wouldn't even scratch the surface of that tool. Like the AFP SMART approach, it's a very simple method for connecting advocacy to impact over time. And it has what I just talked about before, which is a bar on the second part of it that talks about sources of validation. So how you know if you're moving in the right direction toward that impact that you expect. We pair each of those results cascades, which are really simple, 2 simple PowerPoint slides, with case studies where we can go more in depth in terms of the partners who were involved and giving them credit, the decision makers and what their concerns were and how they took on the issue, the policy landscape, the kinds of things that James was talking about with potential opposition, and we can really make the advocacy enterprise much richer and we hope easier to replicate in other countries. James was just in Uganda last week working with the team there to see whether or not there's the potential to replicate the work that he presented on the higher learning institutions. And he used in that discussion the results cascades and the case study that we've developed for the work that was done in Tanzania, so that they have at least an idea of how they might go about it there. So that's the more complicated answer, and there is the results cascade is described in depth on our website in the advocacy portfolio that also includes AFP SMART, so you can find it there. But in order to make that really nice graph that I showed at the beginning with the increase in subnational quick wins, it means that we have to connect an advocacy strategy to a policy change. And that's our criteria, our main criteria for figuring out whether we can actually mark that progress has been made. And once that happens, then we decide where it goes in terms of that chart, and we log it into a quick win tracker that we keep throughout the year. And every partner is responsible for making that link between their work and a policy change. So unless we were actually thinking strategically, we don't take credit for a policy change. Habib, do you have anything? And we've lost James, so Habib, do you have anything to add?
Yeah, thanks, Beth. I think you've said most of the things there in terms of how we track, how we achieve our objective, and how it talks to the larger goal. What I'm just going to add is that I think what we do is to first determine what our goal is. What is the impact we're looking at? And that's what will inform what kind of objectives we set piecemeal that comes together at the end of the day to ensure that the goal is met and we're able to achieve our impact. So, and that's what the result cascade does. So it links all those different objectives along the line to achieving the greater goal or impact that we set out to achieve, and provides a way of documenting and also sharing with colleagues and partners that are also within the advocacy space that we are working together. So they see how we'll be able to achieve the first few objectives that's talking to our larger goal, and where they are also working that seems to be working together in terms of having similar goals. We also use that to convince them to align with us and achieve the greater goal that we were set out to do.
Great.
Thank you.
Thank you, Habib. Thank you for that addition. So it looks like there are no more questions online. So I was going to move towards closing this webinar today. So first of all, I really want to thank all the panelists for attending and all of the listeners for participating in this webinar. And I would like to remind you that this recording will be shared, and there are also those 3 handouts that you can download for more information. And as Beth said, there's a wonderful website of the Advanced Family Planning Project that you could go to and also download many of the tools and also the results cascade that Beth has mentioned earlier. So thank you very much to all of you, and have a very good evening or a good day.
Thank you very much.
Thank you.
Thank you. Bye.
Good day too.
Bye-bye.
Thank you. Bye-bye.